Welcome. So today I want to show you just a couple moves I do for the upper capitis muscles, so the base of the skull on the occipital ridge. Capitis muscles are really small, but they're headache makers. So a lot of times you'll see clients who come in complain about headaches. If things like caffeine and ice make the headache go away, typically it's the capitis muscles. It's those upper muscles that are in a chronic state of squeezing tight. Often with our lifestyles, we're typing and we're forward. And when you're forward, your head has to see the horizon line, or someone walks into your office. And so you crank up here, so you squeeze these muscles really hard. So I'm going to show you a couple of techniques I use to re-lengthen those muscles. So again, these capitis muscles are right here, and they go from the spine to the base of the skull. So that's where I'm going to be working, just this little tiny portion right here. So I'm going to be using a fulcrum, so I'm going to be going this way. And a lot of times I'll bring her away. I'm going to set my hands soft. I'm going to put my fingers on the occipital ridge, and I'm just going to roll her onto them. Just deep breath. As she exhales, I'm going to flex her, and I'm going to traction. This doesn't seem like very much, but it can be very, very intense. She's warmed up, so she's not cringing, but people will cringe. This will be too intense for some people. So as this is after you've softened up here the traps and done all this nice neck stuff, you can do some rotation stuff. You can just get this all softened. Once you're at that level and you need to get these capitis muscles to release more, I'll start with all 4 fingers, and as we get more intense, I'll drop a finger, drop a finger, drop a finger. The less surface area you have on the person, the deeper it will feel to the person. So just remember that. And sort of, I'm looking for those cues. I'm looking for her squinting, her clenching her jaw. I'm looking for all those signs that it's maybe too much. So I'm going to bring her all the way back. And I'm going to bring her into extension, which shortens those muscles. I'm going to set my fulcrum. And I'm actually going to stand up a little bit off the chair, and I'm going to bring her this way. Shorten. I'm going to pin right here, so I'm at about C2, C3. Set my fulcrum. I have her here into extension and flexion, extension and rotation rather. As I get my fulcrum set, I'm going to pick up my whole hand and I'm going to bring her this way. That's going to be pretty intense. So I'll do the other side. So again, I set my fingers, rotate her on, and then I bring her up. You want to be careful you're not pulling the hair. A lot of times we're right next to the hairline, so it can be, sometimes you can snag it a little bit. And as I go up, I'll sort of push her head down in this way, because when people are tight, especially those people who are tight here in that medial scalene, and what will happen is when we try to do an angle, try to do rotation away, people will be stiff and then they'll just drop. So because of that, because C5, C4 is a major point of tension, I'll go back and I'll just get underneath it just to make sure it's moving correctly. Tension in the deeper scalene muscles, deeper neck muscles, can prohibit the joint mobility of the cervical spine, and so that's what you have to sort of be on the lookout for. You know, is she rotating properly at this joint? Because it's going to directly affect how much this joint has been compromised, how much this joint is working, and how much you need to sort of work it to overcome it. So check in with your clients. Look for those look for the cues as far as how much they're moving, how much they're not moving. Look for the joint play, feel for the tension, and practice. Thanks a lot for watching.